Curious about the urogenital changes of menopause? Well, we brought an expert in to talk about it. I'm Dr. Brad Winning.
I'm Dr. Paul Zalzal, and you are?
Dr. Carolyn Bass.
Thank you so much for being here and hanging out with us to talk about this stuff that some people might be worried about, might be thinking about, might be embarrassed to ask about.
Yeah.
We just want to normalize it and talk about it here.
Sure, of course.
Okay, so let's start at the beginning. Menopause comes,
Yeah.
your estrogen levels drop.
Yeah.
It does so many things. We talk a lot about the bones. We're like, oh man, your bones are in trouble.
Okay.
We talk about this all the time.
Okay.
HRT helps your bones. But what else happens in our body, specifically in your area of expertise, when menopause becomes a thing?
So what we call it these days is the genitourinary syndrome of menopause. And that term is a mouthful. GSM.
Yeah.
I love it.
Okay.
It used to be called urogenital atrophy, vaginal atrophy, but the bottom line is that the vulva, the vagina, the urethra, the bladder are all structures whose function and physical structure is supported by estrogen being present in the body.
Okay.
So when we lose that around the time of menopause, again, perimenopause and menopause is discussed a lot more and a lot more openly these days. This is one area of that and one effect of that. So when we lose estrogen in the body, these parts are also severely impacted a lot of the time.
And the main reason that estrogen is a role is because it loses the elasticity as well as a lot of the moisture features, right?
Yeah, so estrogen throughout reproductive life has a major effect on these tissues, whether it's during pregnancy, after, or around the time of menopause. When the hormones are changing, there can be symptoms present. So we're talking about physical changes, thinning out, dryness, irritation, discomfort, loss of elasticity, and that can impact life in a number of ways, including sexual function, from dryness or discomfort from intercourse. It can also have other functioning concerns, including urinary function. More frequent urinary tract infections is a really big one that we should talk about. More urinary urgency, sensations we need to void more often, and
does this syndrome happen like 100% of the time with everyone that's going through menopause? Or is it sort of some of these symptoms, not all of them?
Well, that's where I was going. So there's physical structural changes that we can actually see with our eyes when we're examining someone that happens to the area. It becomes more pale. It loses some of its natural folds, and it definitely becomes dry. So the longer you are from menopause without estrogen in your body, and by the way, we're talking about natural menopause, but that doesn't have to be the case. So women can lose their estrogen from surgical menopause, losing their ovaries from hysterectomy, from chemotherapy, or from direct radiation to the pelvis, or even postpartum or during breastfeeding. These are other times when this can happen, not just from menopause itself that happens as we're talking about it. But those physical changes will happen to just about everybody. That doesn't mean that they're going to have symptoms or concerns about it. Depends on their life and it depends on the way they're functioning. But around the menopause transition, around perimenopause or after, especially with sexual function, these changes might become really apparent. And that will happen 60-80% of the time. It doesn't mean that it's bothersome enough that people need treatment or will seek treatment, but yeah, it's extremely common that can be reported in some studies.
Okay, so that is a pretty common thing. So if you're experiencing something like this, guess what? You're part of the majority, okay?
Right.
A lot of people are feeling this way. So what are some options for you if this is going on?
So the first line options are always what we call non-hormonal moisturizers. So we're talking about vaginal moisturizers that can be used on an ongoing daily basis. There's a number of these in the market, over the counter, with or without prescription.
Okay.
Then there are specific to sexual function for intercourse lubricants that can be helpful. That can help a subset of people in this scenario. If that's not enough, the mainstay and the most effective treatment is vaginal estrogen treatment to the vagina locally.
So local application of estrogen.
Local vaginal estrogen therapy.
And so the first treatment is more for the symptoms. The topical estrogen would be more to address the condition. So it would be more like a longer term potentially solution.
Yeah, it actually reverses the changes.
That's what I mean, yeah.
So when you look at the vagina, if you were to look at a biopsy or under the microscope before and after menopause, it looks much thinner in terms of the layers of skin. It looks different structurally. We know that both the symptoms are improved physically from using local estrogen, but also so are those physical signs, under the microscope. So it reverses the changes, improves elasticity, improves dryness. It also impacts the vaginal pH and the microbiome of the vagina in terms of its relationship to urinary tract infections. So it treats it by almost reversing those changes that I talked about.
Because it's normally quite acidic, right? Like the
vagina
is
is
like a
acidic.
3.5 or 4 or something.
Yeah, the vagina is acidic. It's an acidic pH, and that has a purpose. And the pH is created by the microbiome we talk about in terms of our gut. But there's also a urogenital microbiome that is important for immunity. So the acidic pH helps in the prevention of urinary tract infections by preventing access of E. coli and other bacteria that cause bacterial bladder infections from getting into the urinary tract. So that is one of the functions of the pH. And yes, it will start to rise when estrogen is lost because of the physical changes and the loss of support of the healthy microbiome bacteria that create that acidic pH.
Wow. The vagina is a smart organ.
Yes, it needs to be.
Right?
Yeah.
It needs
Now,
to be.
one of the key things you said that got me interested is that that it's reversible. Like, it's very rare
Yeah,
we have
medicine,
conditions in our world that are reversible by treatment. You know what I mean?
I mean reversible
Yeah,
physically
well,
by
that is.
looking at it when people have done studies. It's not immediate. Like if we
Yeah.
think about this shedding of skin from our body anywhere, like we're always creating new cells, we're always creating new layers of skin. It's similar in that it takes time. So when you replace estrogen, it can take actually up to 12 in the vagina locally. It can take up to 12 weeks to have that
That's not
completely
bad.
reversible changes I'm talking about. But the point is it changes the structure or changes the function back.
That's fascinating.
And so, I don't want to make, nothing in medicine or life as we know is 100%, but it's usually very significant in terms of the treatment effect.
Okay, so, and that's a prescription, I would imagine.
Yes, it is a prescription.
And is it a dose control thing, or is it just sort of one dose for everybody kind of thing?
It depends. What's really important to say here is that this is different from systemic menopause hormone therapy, which is what we're traditionally usually talking about for menopause, in terms of estrogen with or without progesterone for menopause symptoms that everybody is hearing about, including hot flashes, sweats, mood changes, insomnia, and all of that. Plus, right? The list increases. We're talking about local symptoms in the vagina and the bladder. And the treatment is local.
Okay, so it's not a lot of systemic absorption of the
There is
estrogen.
not a lot of systemic absorption, and the reverse is also true, that systemic hormone therapy is often not enough to help with the local symptoms. So many women who are who are being impacted by both sets of symptoms will need to do both.
Oh, wow.
And it doesn't increase the risk of either or, because when you use local estrogen in the vagina, we use it in what we call a low dose format. So many times it's twice a week or broken up in the week to a upper limit of a dose that we know after lots of study is unlikely to be systemically absorbed.
Yeah,
so it's
hit
not
the
going to
ceiling of the treatment.
yeah, so it's not going to increase your systemic levels of estrogen, which is why the risk profile is different. There is not the associated risk of heart attack, stroke, or the slightly increased risk of breast cancer or estrogen-related cancers from using local estrogen. So that's very different as well.
So yeah, and that's often we find in our world too. Topical treatment ends up being much safer than a systemic treatment, but has
depends on the absorption
Right, it has
and
a
the
local effect.
Yeah.
So this seems like a great thing. Seems like it's really successful. Is there any reason for someone to not do this? So if you have these symptoms at home and someone's like, no way, I don't want to do this. What would be, is there a reason that people are just not using this all the time? Like, why wouldn't everybody use it?
Well, I mean, there are reasons I'll get to. There are medical reasons why you may not be a candidate for the therapy.
Okay.
But I would say the first reason really just is embarrassment. Again, we've talked about this, not mentioning it.
Not anymore. I'm talking with docs.
Exactly.
You can't be embarrassed about it.
100%. So, and otherwise, misconception about what we're talking about. Many people will feel the same ongoing fear about hormone therapy in general, and that will include vaginal hormones, which is not the case.
Right.
Or
So they
should
think,
not be,
I don't want to
should
have
not be
breast
in the same
cancer. I don't want to
category.
have a stroke. I don't want a blood clot.
And if you have a family history of breast cancer, or even if you had a personal history of breast cancer, you may still be a candidate for this. And we use the vaginal estrogen in breast cancer survivors more and more now. So misconception is the first thing. Are there contraindications? Of course. So if you're undergoing active treatment for an estrogen-sensitive tumor of the uterus, the gynecologic organs, or the breast, then you may not be a candidate for even vaginal estrogen therapy.
Right.
If you have any other conditions, including undiagnosed bleeding or concerns of that nature, or other reasons why you can't apply it vaginally, then those would be reasons why you can't use it.
Okay.
Or allergy or rash or
allergy or rash, and that has often more to do with the components and other ingredients in the preparation than the estrogen itself.
Gotcha. Okay.
Okay.
So that's local.
Yeah.
Can we go into systemic?
I think I'm assuming that there is, you just said maybe there's not systemic treatment.
For genitourinary syndrome and
Yeah.
menopause? For
Yeah.
GSM?
Yeah.
There is actually an oral treatment for urogenital symptoms. There's a medication, osmifene. It is what we call a SERM. It's a selective estrogen receptor modulator, which is going to be similar to a medication commonly known for some as tamoxifen that we use after breast cancer.
Right.
It's in that same family, but in osmifene is a selective a different type of that family of medication that will allow for an estrogen effect. It's taken as an oral pill in the vagina. You take it every day, and it doesn't impact the other organs.
Okay.
So that's been around a number of years now, but that is an oral treatment. That's the only thing we have that isn't applied locally.
Okay.
Okay, and then hormone replacement therapy, I guess.
Hormone replacement therapy we use again for systemic symptoms of menopause that is hot flashes and sweats and those symptoms that I mentioned.
Help this
But
syndrome.
it often is not enough to treat the
gotcha.
local symptoms. And that's why we use estrogen locally. So it's kind of two separate things. Many people might need both.
Okay. So that's awesome summary for the vaginal dryness side. Let's go to the UTI side because we have a lot of patients. Obviously, a lot of our patients are older, getting hip and knee replacements. A lot of them are canceled for surgery because they all the time. Unfortunately, they have a UTI or they've kind of had a UTI like forever. They have ongoing prescriptions that are just ready just in case. So this is a really very significant issue on a whole bunch of different levels. We worry about the joints getting infected. So we know that people that are in menopause have a higher chance of this. What do they do? I guess starting with like hygiene and bladder treatment and that kind of bladder programs or planning up to and including antibiotics to deal with that kind of side of things.
Well, in the context of what we're talking about, recurrent urinary tract infections are much more common after menopause. And I think that's what we're talking about. And so that's from, again, the vaginal pH changes and the loss of defense against the most common culprits of bacterial urinary tract infection, which is E. coli and other bowel bacteria.
So from your colon, okay.
And so
the neighbors.
and so it's a super frustrating problem, recurrent bladder infections. The definition is 3 or more UTIs in a year. And that can easily be, occurring for lots of women in this category. So I want to really encourage the use of local estrogen treatment in these patients because it has a very dramatic impact on reducing the frequency of urinary tract infections. There's a lot of science on this. There's a Cochrane review. There's all kinds of science on this. And again, because of the misconceptions of use of estrogen and the safety concerns in general, I think it's been put in that same category, not used as much as it should. But it's one of the most effective ways of preventing UTIs. I want everyone to know that. And so that doesn't need to be started by a gynecologist or even a family physician. It can be started by anybody. Because of the safety concerns not being the same and because of the limited systemic absorption. But again, one of the most common preventative strategies in women.
I love that. Simple, affordable, safe.
Yeah, absolutely. Other than that, lifestyle factors always making sure you're drinking enough water, increasing water intake for those that are not getting enough water has been shown to reduce urinary tract infections. There are some cranberry-like, supplements that can reduce the frequency of urinary tract infections. It depends on the concentration and what the supplements are. Not even cranberry juice, but there are supplements out there that contain, a concentrated extract from cranberries, called PACs, that is effective when present in the urine in preventing the E. coli from climbing and growing. So that's a supplement that's helpful. And then again, avoiding constipation, because constipation is also a risk factor. But the estrogen is huge in this treatment.
Amazing.
And then I guess when it comes to so if you have an infection though, obviously you have to treat it.
Yes, of course.
Prevention side, yes. So you treat it, and then are they also? I'm assuming if you have more and more infections, you're a higher chance of getting something that's resistant. So getting more complicated bacterial infections that not only could be a UTI, but then could go up into your bladder and cause cystitis, or even worst case scenario to your kidney, pyelonephritis. It can be very serious. So.
Of course. So urinary tract infection requires treatment.
Yes.
Bottom line. So don't.
You can't walk it off.
Don't think that. I do not suggest using supplements in the treatment of a urinary tract infection. If you have sudden or acute symptoms of burning when you pee, blood in your urine, or pain with voiding, lower abdominal pain, fever, back pain, those are signs that the infection has gone to the kidneys. You need to seek medical care.
Yeah.
It is very likely you will need antibiotics.
Yes.
The role of prevention is not only to prevent the extremely uncomfortable inconvenience of having this over and over again, but to reduce your overall need for antibiotics in your life. Because although it's a super important treatment, can be life-saving in situations of acute infection, of course it can impact your microbiome, your immunity, but there is the increased risk of, with long-term and repeated use of bacterial resistance. This is the thing I have to explain a lot as well, is it's not that the person is resistant to the antibiotic, it's that the bacteria that are causing the infection have learned or found a way to get past the antibiotic and keep on growing.
Yeah.
So it's bacterial resistance of all kinds in the community that we're trying to prevent from not overusing antibiotics.
Totally.
So urine culture or urinalysis will help diagnose whether you have a urinary tract infection. Treatment is needed, and then these strategies I mentioned are prevention to reduce the frequency, the discomfort, and the need for the treatment.
Love it.
Wow. That's a lot. I love the part about bacterial resistance. We made a video before about this with our infectious disease specialists too. It is a big thing that we
Those are
worry
the
about
experts.
in society, right?
Oh, yeah.
It is a major problem.
Because we need them,
Yeah,
and
we
we
gotta
don't
save
want to
them.
lose our options.
Gotta
Right.
save them.
Yeah.
That's a great summary. Thank you so much for that.
Now you guys know. So if you have any of these symptoms, first, know that they're very common. Second, know that your doctor is going to be prepared to help you. And lastly, know that there are really good treatments to deal with them and prevent them from going forward. So if you like this video, please like it, subscribe to our channel, share it with somebody you think could benefit from this information.
And remember, you are in charge of your own health. We can't thank you enough for being here. Our viewers wanted you to come back. Now you're a regular.
Every 2 years, whether you need it or not.
We'll see you in a month. We'll be back.
Okay, so we'll see you next time.
Okay.